this year in our health system transformation webinar series, Speaking Up and Speaking Out. And today our topic is RNAO's nursing career pathways, your feedback, your voice. So warm welcome to all of you and thank you for joining us and participating in this webinar today. My name is Susan McNeil. I work on the implementation science team at RNAO and gladly help to support these webinars. I'd like to start with a land acknowledgement, and we recognize that our work and the work of our members and all of you takes place on traditional Indigenous territories across Ontario. We also wish to acknowledge that the office of RNAO is located on the traditional and unceded territories of the Huron-Wendat, Haudenosaunee, and the territories of the Mississaugas of the Credit. This territory was the subject of the Dish with One Spoon Wampum Belt Covenant, which is an agreement between the Iroquois Confederacy and the Ojibwe and allied nations to peaceably share and care for the resources around the Great Lakes. We also acknowledge that Toronto is covered by Treaty 13 under the Toronto Purchase Agreement with the Mississaugas of the Credit. We also recognize that the participants, all of you today, are located on other traditional lands across Ontario. And today this land is still home to many First Nations, Inuit, and Métis people from across Turtle Island. And we're grateful to have this opportunity to work on this territory. By personally making a land acknowledgement, we're taking part in an act of reconciliation, honoring the land and Indigenous heritage, which dates back more than 10,000 years. We encourage you to learn more about the land that you reside on and the treaties that are attached to it, because land acknowledgements are an act of reconciliation and we must all do our part. And there's a link there on the bottom right if you want to learn a little bit more about the land that you work and live on. And just glad to open this session today with a land acknowledgement. And I'll pass things over now to Dr. Doris Grinspun, RNAO CEO. And just a quick reminder that the session is being recorded, so you can listen to it again or share it with your colleagues after today. So over to you, Doris.
Thank you so much, Susan, and thanks, colleagues. On behalf of our president, Dr. Claudette Holloway, and all the team and the board at RNAO, what we are sharing with you is work in progress. And because it is work in progress, we want to consult broadly. Just so you know that the work that you are going to be hearing about today is work that also we sent an open survey to our entire assembly of leaders. We presented to the board and discussed with the board at our last meeting about a month ago or so. And we also sent to members of the Joint Provincial Committee. We sent to our Chief Nurse Officer in Ontario, Dr. Karima Belgi, to the Chief Nurse of Ontario Health, Judy Linton. We sent to our colleagues at ONA, our colleagues at RPN, and to others. So please know it's broad consultation and all of your feedback is welcome. Why? Because we are on a very challenging yet important opportunity in Ontario. Often when things are very difficult is when you can leverage to make things a lot better than what they were even before. And to many of us, nursing has all along been a feast of opportunities. And we need to deal with the challenges that there are so that feast of opportunities can be materialized for nurses. So with that and the great attendance that we have today, we want to share with you this work. We want to share the career path that nurses have in Ontario, the possibilities of those career paths, why it is important, and what is it that we have found. This was an idea that began as a mirror for all of us in the profession, so that we can look into this into this model of career path that you will see. And you can be one of those people. If you are a PSW, which we did invite, you can say, no, I want to be a PSW and I want to stay in my career as PSW because this is what I like to do, or because this is given circumstances in life where I need to stay for the next 10 years. Or you can say, well, I am a PSW and maybe I want to become an RPN, maybe I want to become an RN, or I am an RPN and I may want to stay as an RPN, or I may want to venture into becoming an RN, and an RN, same situation. I may want to do specialties. I may want to stay forever as an RN without a specialty, or I may want to become an NP. And all of that, colleagues, is fine. All of that is fine because the great majority of people in the health profession, from PSW all the way to NP, they actually stick around with their roles for whatever reasons that they choose, and whatever reasons that they choose is their reasons, and it's totally okay, as long as it's not because they experience barriers to move on to another career path that they would like. That's where then the advocacy of RNAO to tear down barriers and create only opportunities comes to be, but not because your role as PSW is not what we respect, or RPN or RN or NP for that matter. So with that in mind, let me show you the first slide and give you an idea. And then Cristina Pulano, who with the policy department, and Matthew Calloway, the director, did a lot of in-depth analysis of what is it that we have. And we haven't even finished the homework in terms of specialties, for example. So this will continue to evolve, but we wanted to bring you early on into this journey and hear from you. And then we will tell you about what's next steps. And hopefully in February at Queen's Park, we will release a document that will have had your input. And it doesn't mean that it will be a document forever the same as ECHO. If you remember ECHO, Enhancing Community Care for Ontarians, we already did the third reiteration, and it will be a fourth. Here also, with time, we will do more and more. So this is the journey. This is the journey by domains of practice, by sectors, and I will let from here on Cristina Pulano. Cristina, please introduce yourself and take us on into this journey. And I also want to say to people, we already have over 100 people. I want to say to people that the response from partners has been amazing. We only sent, I think, the survey on Thursday, if I'm not wrong, and we sent the letters to the colleagues of WeRPN, ONA, and others, including the chief nurse on Friday, I think, and I already heard from several of them. So thank you to all of you for your active engagement. We will be presenting this at the Joint Provincial Nursing Committee, and it may become our common journey for all of us together, and that will be fabulous if we can. But with that, let me give to Cristina, and if people have questions, Cristina, in the middle, especially that is a lot of people, this is not about completing all the PowerPoint. This is about stopping whenever you have questions. So let me stop first here on the intent of what we are presenting in case that there are any questions, Cristina, and then to you. And if people interrupt, Susan, let people ask the questions as long as we also move along at least one slide at a time. And then after each slide, we can ask if people have questions. Any questions so far?
I don't see any questions in the chat box right now, Doris. Yeah.
Okay, Cristina, all yours.
Hello, everyone. Thank you so much, Doris, for the wonderful introduction. I'm very, very pleased to be here today and presenting some of our work so far. I'm very excited about this project, and I know that many of us at RNAO are very excited, as well as external colleagues that we've started to share with. So my name is Christina Polano, and I am a nursing policy analyst with RNAO's policy department. And today I will be walking you through our progress to date on our nursing career pathways graphics, which we are continuing to develop based on detailed feedback process, as Doris had described. So I will be describing the components of the graphics as well as the data found within the graphics. And then we will open it up for a discussion, and you will have the opportunity to provide some feedback, which will inform the ongoing development of the graphics. And as Doris said, Susan, please stop me anytime if there are questions. That way I can address them in real time while we're looking at the specific portion of the graphic. So I would be happy to do that. So as you can see on the current screen, we currently have two graphics that we have developed to date, which are meant to provide a detailed snapshot of the existing nursing student population and workforce in Ontario, as well as outline potential education and practice pathways for nurses in Ontario. The two graphics seen are the same in terms of the top halves, which represent educational pathways, licensing examinations, and current registrants with the College of Nurses of Ontario. And for the graphic on the left, the bottom half provides a detailed snapshot of the nurses working across different domains of practice within Ontario. And for the graphic on the right-hand side, the same nursing workforce in Ontario is represented based on the sectors that they are practicing in. And we'll move to the next slide, and I'll jump into. So we're first going to be taking a look at the educational pathways part of the graphics. And in the next slide, we're going to actually be zooming in so we can get a better look. So for the educational pathways are demonstrated above each designation, which you see here. And we are continuing to seek out numbers. As Doris said, this is completely a work in progress, where we see blanks currently, in order to capture the most accurate totals possible for the missing boxes, as these data have been a little bit more difficult for us to obtain due to reporting issues. But to give us as complete of a picture as possible, we actually included 3 data sources so far for the educational pathways, and we're, as I said, seeking out more. So the data in pink so far are from Cozen's Registered Nurses Education in Canada Statistics Report from 2020/2021, and that was actually recently released in November of 2022. So the first numbers in pink that you see represented on the screen represent the number of graduates from each respective type of Ontario nursing program in the 2021 calendar year. And the pink numbers in the brackets represent the change in the number of Ontario graduates from each program compared to the prior year. So it gives us a snapshot really easily and quickly about the number of graduates that we're seeing from our province, as well as the change from last year. And in teal, the data in teal comes from the CNO's Nursing Registration Exams Report of 2021, and it represents the number of prospective nurses who passed each respective nursing licensing exam in 2021. And then lastly, the data in brown are from a CNO data request that we had sent in, and they represent the yearly change in the number of master's prepared RNs and PhD prepared RNs and NPs registered with the CNO based on 2021-2022 data. And so right away, we can see the feast of opportunities, as Doris had said, in the way of educational pathways. And I can jump in for each type of designation, the type of pathway that one might follow. So after attaining a high school diploma, prospective students can, for example, can pursue, as an example, any of the following. So a college level PSW certificate would be the educational pathway at this time to become a PSW. Completion of a college level practical nursing program and RPN licensing exam would be the pathway necessary to become an RPN in Ontario. And to become an RN in Ontario, the educational pathway includes attaining a baccalaureate degree in nursing. So for example, there are several baccalaureate degrees offered: standard, generic, collaborative, accelerated, fast track, advanced, second degree entry, compressed, RPN to RN, so our bridging, and our post-RN baccalaureate are just a number of baccalaureate level nursing degrees offered in Ontario. And then the second part of building that educational and career pathway would involve passing the NCLEX exam prior to registering with the CNO as an RN. After this step,
Christina, it already triggers me to think one thing, that we could do a belly between PSW and RPN, and which program allows people to do that, and it's the Begins program that people can apply through RPN. So it already triggering me to think what helps can be possible. Again, not that people must do that. People can stay in their role, but if they were to do that, what financial support could be available for that? So between
Absolutely. I'm
RPN
glad
and
you brought that
RN,
up.
the NEI, etc.
Yeah, I'm glad you brought that up, Doris, because I don't know if we mentioned, but the third graphic that we're looking at is highlighting the opportunities and constraints, and that would be one that I was thinking of as well, is these types of programs offered by the government and other partners that would really help us to progress through these educational pathways. So if anyone else has any thoughts in mind to share with that in mind as well, just know that we are creating a third graphic, and those are the types of opportunities that we would love to display. So after this step, we'll move into the graduate level preparation possibilities. So RNs can choose to partake in the following educational pathways to become a master's prepared RN, including our advanced practice nurses and our clinical nurse specialists. A master's degree in nursing or an applicable subject is typically necessary for that type of role. And then to become a nurse practitioner, the educational pathway would include a master's degree in NP certificate, as well as completion of an NP licensing examination. And then master's prepared nurses can also go on to attain a doctoral degree, as many of us know, in nursing or in another applicable subject in order to advance their education if they so wish. And please note that we are, I was gonna bring it up at the end of the slide, but again, we're in the process of creating a third graphic to capture really the opportunities and the constraints related to building nursing career pathways in Ontario. So some of the examples of the opportunities we would love to highlight in that graphic would be things like increasing nursing education seats, because as Doris always mentions, there is an increased appetite for nursing students to enroll in these types of programs, which is such amazing news for us. And then also considering faculty requirements to make that possible, bridging programs to make the transitions easier between different designations, as well as IEN registrations and their career pathways. So more to come on this at a later date, as Doris had said. So for now, that wraps up our education pathways. I don't know, I feel like there might be some comments already that we might want to look at, or maybe not, but.
I just have one question, Christina,
Yeah.
in the chat, and that is, do we have any idea on why the PhD in nursing may have decreased?
Yeah, so that's a trend to definitely keep an eye on. And there are some other figures in that Causin report related to projections relating to faculty. And so in order to support our increased seats and increased enrollment, we do need more PhD prepared nurses. And so thinking about ways in which to promote that level of education for nurses would be great. But yes, it's something that we've noticed in terms of trends and an important one to keep an eye on.
And I want to comment, Susan, thanks for your question. In addition to Christina's comment, the difference between the US and us, and I'm talking about many universities in the US, certainly the top ones, is they accept PhD students with full funding covered, full funding. I'm not just saying with no need to pay tuition, but funding to actually do the PhD. Full scholarships. This is not only nursing, in everything. This is why so many people from other countries end up going to the US, by the way, right? So that's something we should look, because that's something that, again, on the issue of increased seats, Christina is aware the government did increase seats, and it was as a result of RNAO with COU, College of Ontario and Universities Council, the Council of Universities of Ontario, that we succeeded to have the government increase seats. So not that we don't need to do more, we do, because the appetite is huge for nursing, thank goodness. The same, we should be pushing for funding for graduate studies. In addition to the NEI, which is $1,500 a year that people are, that is available through RNAO, right, for a master's and PhD. But it's a lot more that can be done if we indeed want to have, and we need to have, Susan, because as you know, and we don't want to get into that, but the biggest retirements will come in two positions, chief nurse executives and faculty. So not for this presentation, as Christina said, for future ones, but that goes together with the piece of then, okay, what's the advocacy? What do we need to push again, right? So you all know we are pushing the issue of Bill 124, we are pushing workload. What else if we need more PhD prepared nurses? What else if we need more NPs, given the news that we don't have enough family doctors in this country and in this province? So keep that thought, because all of that and the input from colleagues will continue to build this up.
Christina, I just note another question about why a nurse might want to get a master's or PhD. And I'm thinking you will be covering that in the go forward in terms of domains of practice.
Yes, it's going to come up then, and then we can address that question because it'll give us a fulsome picture of the different domains of practice. So that might be the best place in the presentation to talk about the different roles and things like that.
Keep going,
Oh,
Christina.
all right,
you.
so we're gonna advance to the next slide, and we're gonna look at the next part of the graphic, which is focusing on the number of registrants with the College of Nurses of Ontario. And so we'll move forward one more slide, and we're gonna actually zoom in. Yeah, perfect. So the data on this slide is from the College of Nurses of Ontario's registrant statistics. So as of November 1st of 2022, there were 63,595 RPNs registered with the CNO in the general class, representing an increase of 5,971 RPNs compared to December 31st of 2021. There were also 124,203 RNs in the general and extended classes registered with the CNO. This number includes 119,509 RNs and 4,694 NPs. This represents an increase of 7,793 RNs and 342 NPs registered with the CNO as of November 1st of 2022 in comparison to December 31st of 2021. And so the increase in CNO registrants over the past year has a lot to do with the policies put in place to improve IEN registration processes, which is something that RNAO has tirelessly advocated for and continues to advocate for. And I would also like to point out that although nurses might be registered with the CNO, that does not necessarily mean that they're currently practicing in Ontario, which is why we're referring to them as a potential nursing workforce. And we'll get into the different pools of nurses who might be registered and not practicing and what that might mean in terms of hopefully bringing them back into our workforce. And so we'll move to the next slide with that. So now we will take a closer look at the pool of nurses who are registered with the CNO and who are actually practicing nursing within Ontario at this time. And so the data seen in blue includes up to December 31st of 2021, and this is the most recent data available at this time to represent nurses employed in Ontario. But updated data will be available in the new year, and we will be requesting it at that time after the yearly CNO renewals are completed. But as of December 31st of 2021, there were 51,414 RPNs, 100,203 RNs, including 9,484 master's prepared RNs and 798 PhD prepared RNs, as well as 3,960 NPs, including 121 PhD prepared NPs, so all of which are employed in nursing in Ontario at this time. And when considering the number of nurses registered with the CNO during the same time frame, including those in the non-practicing classes, it can be noted that 83.6% of RPN CNO registrants were practicing nursing in Ontario, while 16.4% were not. 81.6% of RN CNO registrants were practicing nursing in Ontario, while 18.4% were not. And for NPs, 91% of NP CNO registrants were practicing nursing in Ontario, while 9% were not. And so these numbers really represent a proportion of Ontario's nursing registrants that we would hope to bring back into the nursing workforce in Ontario through policies and programs, which we've talked about a lot in our advocacy tools. And this group of nurses would include those in the non-practicing class, those working outside of Ontario, those who are seeking nursing employment, the nurses who are not seeking nursing employment, and nurses who are on leave. So there's a pool of nurses who are registered, who, as I said, we would hope to bring back into the nursing profession through effective policies and programs. And we can move to the next slide unless there's any questions related to this.
Yeah, Christina, there's a question about asking about the nurses outside of Ontario. So can you say a little bit more about that?
Yes, that's a great question. So I think I had mentioned prior that, when we think about the third graphic, we really want to highlight the IEN pathways that one can take, but these numbers in and of themselves actually do include our IEN registrants. So our 63,595 registrants and the increase that you see next to it, same for the RN, 124,000 registrants, and the increases that you see next to it would encompass those IEN registrants who are joining our workforce. So we see them as being represented as part of our workforce in this graphic, but we also want to represent them as an opportunity to continue to, promote their participation and their registration in our workforce, which is why we're going to showcase them again, perhaps in a different way in our third graphic. So if that helps.
And don't leave, there is a question by one of the colleagues that says, where can we access the infographics and where can we find them? We will post it in a formal way alongside a survey in the new year. We want to hear first from the Assembly of Leaders because we send that to them, and we want to hear from the colleagues of RPN on a college that we send to them with our chief nurse, etc. We will incorporate their feedback, and we definitely put an open survey to people, and we need to differentiate between Ontario and the rest of the country, because there is no reason why others couldn't do that the same in another jurisdiction. So thank you for that question. And yes, and we will seek out your written feedback on that for those of you that are interested. So thanks for asking about that.
Perfect. So let's see here. Okay, yeah. So based on the nurse, let me just try to catch my bearing. Okay, we're moving on to the domain. So based on the nursing workforce that is employed in Ontario, as seen in the last slide, we will now take a closer look at the domains of practice that they are working within. And so we'll move to the next slide just to zoom in a little bit. While we acknowledge that nursing roles largely include a combination of clinical, research, leadership, and educational duties, we utilize CNO data to ascertain the primary domains of practice that nurses are working within. Specifically, we use CNO primary position data to sort nurses into a primary domain of practice. As you can see based on the graphic, the majority of nurses across all categories are engaged in clinical nursing roles. However, there are nurses practicing across all domains for all designations, which is really great to see. And as Doris had mentioned earlier, we're continuing to explore ways to represent things like nursing specialties as another crucial aspect of building nursing career pathways. Also, when analyzing trends, it can be noted that although the majority of nurses prepared at the master's and doctoral levels remain in clinical nursing roles, there is an increased proportion of graduate prepared nurses practicing in the education, research, and leadership domains of practice, signifying that graduate level education is a great way to prepare nurses for these types of roles. And we can move to the next slide. We will now examine the sectoral analysis of our second nursing career pathways graphic. And we'll zoom into that on the next slide as well. So for this component of the graphic, we again use CNO data to ascertain the primary healthcare sectors that nurses in Ontario are working within. Specifically, we use CNO primary employment setting data to sort nurses into the healthcare sectors that they are currently primarily working in. This graphic demonstrates the dispersion of the nursing workforce across practice sectors. I won't read through all of the numbers. I'll give you all a chance to take a look for yourselves, but some highlights are as follows. Based on the data, it appears that the majority of RPNs work in hospital settings at this time, followed by long-term care and home and community care settings. The majority of RNs are employed in hospital settings, followed by home and community care and long-term care settings. The majority of master's prepared RNs, including NPs, currently work in hospital settings. Majority work in hospital settings at this time, followed by primary care and college/university settings, and the majority of PhD prepared RNs, including NPs, are currently working in college/university settings, followed by hospital settings and other community settings. And I really love this portion of the graphic because it really demonstrates the fact that nursing is such a diverse profession, and you can find yourself in any of these sectors in a variety of different roles and be able to build your career in that way and explore nursing as a profession. So And so just to wrap up my summary of both of the graphics, we hope that these graphics provide a clear snapshot of the domains and sectors that nurses are currently working within. And it would be interesting, for example, to update these graphics and monitor trends in the nursing workforce over time. And I know Doris has explained many of the ways that these graphics can be used in order to, for example, inspire future nursing students or to get the public to be aware of our profession, or like Doris had said, to use it as a mirror to just look at ourselves in our own career and imagine the possibilities of that. So thank you so much for the opportunity to present, and I guess we can address any questions and move on to the discussion.
I want to make a couple of comments, and meanwhile, I would love to ask Susan if she can work offline with Olivia to create a few rooms of free flow thinking, Susan. I would say 20 per room or 15, not even more. But let me make a couple of comments. First of all, the comments on the chat are music to my ears, and to Christine and to Matt and all of us, I'm sure to Dr. Holloway, that we have been talking about this, because it shows the appetite. It shows the appetite. Not that staying in one's position is not a good thing. I want to reinforce that. It is completely good, and it is respectable, whether it's PSW, RPN, RN, NP, CNS, whatever it is. But to show that we have a vibrant profession, to show that, first of all, we know there is an increased appetite for nursing, because there is a huge increase in applicants, both to baccalaureate and to RPN also, and to nurse practitioner, but also to show your comments of I would if. It shows that there are things that we can advocate for the if to happen, if that's your dream and your choice. That's number one. It shows that, you know, I don't know about you, but one of the reasons I chose nursing as compared to, for example, medicine or another longer studying profession, is that it was a feast of opportunity. First of all, it was that I would be much closer at the human level with patients, in addition to the clinical expertise. But another was that I could do this specialty and then this and then that, and then mix things, that it was more mobile in terms of not only countries, because I didn't even think about countries at the time. I ended up in many, but I didn't think of that. But yes, about specialties, that today was rehab, maybe tomorrow was oncology, maybe the day after, the 2 years after or 3 would be, you know, and today the newer generation, I think, also thinks in that way, perhaps. So to see that there is the appetite is hugely important, from what to advocate, what advocacy next, in addition to, you know, compensation, in addition to workloads, which is critical for all nurses, but also how do we open these pathways? Because if we can build the opportunities in Ontario and allow nurses in whichever area, and including that PSWs, to fulfill their dreams, not only the must, right, but their dreams, I think we will retain nurses big time. And second, it strikes me that the comparison at one point between what the US offers, we should think about that, versus what we offers, in terms of from PSW to RPN or to RN, from RN to NP, from NP to etc., or PhD, or an RN with the etc., right? I think it will be an important comparison, as we have done, for example, in other areas, because whether we like it or not, geopolitically, this is where we live. Nurses are not going to likely go to Europe to do a master's or a PhD. They will go to the US if they offer the sun and the moon, and they will stay in the US. So I think, not now, but I think that's one piece that we may need to look in the future also. I suggest that let's tackle the questions that are on the chat, Susan, but also then if you can divide us just for the following. Is what we presented so far clear? Is it useful? Does it allow to be a mirror for you guys to see yourself in the picture, and to see what else can it be if you didn't have any barriers, if you didn't have any constraints. And then we will come back in 2 months with more information, and we will continue to consult with all of you so we can tackle the key aspects that need to be addressed to really enable nurses to build career pathways in Ontario, whether to stay in their position or to look at other possibilities, and what are the key salient points that need to be addressed. Susan, back to you to moderate a bit, and then.
Sure. Thank you. Yes, the chat box has really become very lively. There's a theme where people are talking about funding and resources so that they can pursue their degrees and their passions and further education. And that there is, you mentioned programs similar to or in the US, and could we have more of that here? There is a question from Rahim. What are opportunities for master's prepared nurses if they wish to get NP and would like to work in clinical roles? So maybe we'll start there, and then I'll go through some of the other questions.
So I can comment in some of the opportunities that I don't even know if people are aware. And again, this is something that our policy team, we are working on, an inventory of all the financial opportunities and supports that are there. Because every time that we attend a meeting, we learn even of initiatives that not everybody knows. So there is the Grow Your Own, and it has existed for quite some time. Of course, we will need to see Matt and Christina that is still alive, but the Grow Your Own initiated with long-term care at the time, and it was to have NPs in long-term care when RNAO first pushed the issue of NPs in long-term care, which now is moving along and people are hiring NPs. So Grow Your Own was that the home will identify that they have X number of RNs, 1, 2, or however, that wish to become NPs in their nursing home, and there was coverage for them to do so. So that's one. We will see if it's alive, and perhaps one area to push is that that be available also to other sectors. Although, as you know, long-term care is a priority at this point also by RNAO in terms of nurse practitioners, right? We want to have at least 1 NP per 120. The minister says 125, Minister Calandra, that's also good in each nursing home. And I do know of homes that are hired 1, 2, or even 3 NPs. So that's one. Second, we also should be pushing NPs in primary care. And I'm saying in all the models of primary care, simply because what's in the news. We do know less people are applying to family practice within medicine. Well, more people want to become NPs than ever before. So there is a misalignment there. Let's make sure we advocate. It's not instead of doctors. Let's not try to do instead. It's not about the instead, but places that don't have an NP, that don't have family dogs, and dogs are decreasing the number of patients. It was in the weekend in the news, right? Because they simply cannot handle the stress. There are NPs in some of those communities. That's something that RNAO is already pushing. So there is also the NEI that people can come to RPN, to WeRPN for if they want in 2 programs at the very least that I'm aware, and if Diane is here or someone from WeRPN, please pitch in. But I do know the Begins program from PSW to RPN or to RN is through RPNAO, and they cover and they have coaches, etc., and support. There is also the NEI that is both through WeRPN and through RNAO, where if you apply from RPN to RN or RN to NP, you can receive $1,500 a year. So those are programs that exist. That's not sufficient for what we need to do, but it's a good beginning that other jurisdictions don't even have. We always like to see what's full in the cup and how do we fill the rest so that we acknowledge what has been done so far. Correctional facilities are another area where at one point they were ready to announce. In fact, we review all the materials, and it's an area that we are again discussing for nurse practitioners in correctional facilities. Susan, back to you.
Thank you. Janet's asking about, well, I think you actually kind of responded to this, master's prepared opportunities for NPs in clinical roles. So I think you answered that. Was there anything more that you wanted to say about that, Doris?
I want to comment about master's prepared nurses. Those are not only NPs. I do want to reinforce the importance of CNSs. Not number one, because, well, Janet is an example. She was before she retired, the CNS, Janet Hunt, that I believe she's in the chat, but many others, right? I think Julie Rubel is a CNS. I was a CNS. I was brought to this country as a CNS in rehab, by the way. Let's bring back the CNSs, both as clinical experts and also as managers. Nurse-run units. We initiated that at Sinai back then when I was there. And all kinds of units that if they were managed by CNSs with that level of clinical expertise, it could be tremendously enriching. So the master is for both, Susan, for CNS and for NPs. And I think Julie put the NEI via RPN. Put also the Begins, Julie. The Begins program. Back to you.
Sure, Christina, I think this is a question for you about, is complex care, rehab, and palliative care included in the hospital sector?
So yeah, I noticed there were a couple questions related to the process of how we sorted this. I think maybe the best way to do that is I can include in the chat our explanatory notes, which explain exactly how we sorted each of the CNO categories available to us. And then if there's any feedback on that, we would be happy to hear back. Does that sound okay?
That sounds great. And then if there are any further questions, we can answer those as well. And then May is asking if we can track the number of RNs who work in First Nations communities, either remote First Nations or sorry, I just lost that. But if we can track nurses working in First Nations communities.
So for under the CNO categories, there is a remote nursing station category that we're able to track. We had sorted under the broader category of primary care, but again, open to feedback about the sorting. But yes, it is being accounted for using CNO data. And so we have numbers related to that.
It's going to be a bit tricky though, of course, because there will be nurses hired directly by health authorities and not through the federal government and nursing stations, right? So I think, May, if you're looking for data that tracks who's working for First Nations community through a health authority or something, then I think we could go back as a special request to employer data, and we'd need a list of First Nation employers and go from there, and then probably add the nursing station piece in. Yeah, it's complicated though.
Thanks, Matt.
Could I also add on the explanatory notes that Christina is going to post in the chat that they too are a work in progress, and to the issue of funding and other programs that Doris has been talking about, and there's been lots of chat in the chat about. The explanatory notes are going to be, as we develop them, making reference to those programs with a view to mapping those programs onto the next iteration of this graphic that Christina has made reference to.
And I did post, Matt, two of them. One is the RPN Begins program, which is very good. And I also posted the 208. That's how old is the program, Grow Your Own. Again, when we will have an inventory, I think we will have another. First of all, we need to check that they're still alive, and if not, make sure that they are. I know the Begin program is because it's relatively new, but the Grow Your Own, we should. And if it's not, we should recover them, because this is the time when things are tough. And in the area of NPs, we know that it's tough because there is a shortage of primary care dogs, dogs for nursing homes, et cetera, et cetera. So that will be very good to, we'll take a phone call probably to bring it back. We also need to remember that with the changes at the nursing secretariat, and this is a secret that is now public, every time that there has been a period in the nursing secretariat that the position has been open for some time, this type of programs sometimes suffer the consequences. So now that we have a person in Dr. Karima Belgi that also is an ADM, I know that she will work with us. In fact, I am meeting with Karima today, and I know if we bring to her attention that program of 208 is now not there, and maybe it is, I'm just using it as an example, that she will go to bring it back. She will go for it. Back to you, Susan.
Sure. Just a couple of questions I'll group together, and that's about nurses changing jobs and where are they going, and who's changing sectors and why. And maybe, you know, one person is asking, is this anything to do with choosing not to be vaccinated for the COVID vaccine? So just tie those together, those questions.
I am absolutely willing to answer that. Has nothing to do with the vaccine, zero. It's a tiny minority of nurses that went somewhere else because the vaccine. I know in the media, sometimes the media try to beef up on that, but that's not the case. The great majority of nurses that have left is because of the compensation, and is because the workloads, and because choice in terms of choice of work environment, choice of, I want to be able on weekends or on holidays to be able to be on vacation if that's what I need, or I want to work only evenings or nights. So that's the great majority of change in employment status. But we will build more on that as we go forward. Christina, I don't know if you or Matt want to build on that more.
For me, I think you covered everything I was thinking, Doris, but I'll let you know if anything else comes up. Matt, I think you're.
Yeah, I would add that the CNO is going to be producing a gains and losses report in the next 2 weeks, I think it is. It'll be interesting to see, because this is an issue we've been trying to get at, and they've said to us, well, hold your horses, we're putting out some public data on gains and losses in the profession. So we're waiting to see what's in that public report and whether we've got to do a special request to dig a little deeper on where these gains and losses are happening. There are other data sources out there, StatsCan, the labor force survey. That's very interesting because we've looked at that, and you will have seen on Twitter and other places discussions about massive losses in the workforce, looking at labor force survey data. But these things, the numbers vary dramatically month over month. So pick your month, pick your 2 months, your end and start date, and you can come up with wildly different numbers about what's happening in the profession. So all of that's to say is we're trying to get at some reliable data to see both gains and losses in the profession, but also churn. So who's moving where, et cetera, et cetera. And it's hard to get at these things, of course, because you could, have 500 people head one way and 500 people head the other way, and you have no record of any churn there. Just all the numbers look the same at the end of the day. But the issue of nurses leaving jobs and going to agency work or leaving jobs, heading to another sector is, of course, for continuity of care and other issues, very critical one. The other issue I would point to here is that these are head counts you're looking at. So these are the number of nurses that are in the profession, and it doesn't account for hours. And so we've got a request into the Ministry of Labor that's taking an enormously long time to get back. That will tell us something about the number of hours and therefore FTEs of work that is actually happening in the nursing profession by sector. And that'll be important because what we might see is that the headcount doesn't change that much, but nurses are doing fewer hours, potentially. We'll see what we see in terms of how many hours nurses are putting in. Anyway, all of which to say is we're poking and prodding and trying to get at these numbers. It's tricky though.
Yeah. Thank you, Matt.
Can I ask a couple of bring forth a couple of questions that kind of on the theme of equity? And one question is about the demographics of those who are graduating with PhDs, and does it reflect the diversity of nurses in the profession? And then the other question is for Maxine, looking at supporting nurses who want to advance their careers and their lack of resources in the North, and the need for not only funding, but support for success, like support for math, chemistry, those kinds of topics. So those are kind of related to equity, but different topics. So I just want to bring them both forward.
I think the latter we will address more when we look at what are the challenges and opportunities, just not to put the cart ahead of the horse. But we acknowledge that that was one of the reasons why Grow Your Own actually was built. So I think that's very important. And the first, can you repeat the first one, Susan?
The first one was about nurses who are graduating with their PhDs and to what extent those nurses are reflecting the diversity within the nursing profession.
Likely not sufficiently at this point, but my view, and I would like the comment of our president, Dr. Holloway, who I know is here. I don't know if Dr. Angela Cooper-Brathwaite or Corsita are here today from the task force. My view is that we have unleashed that conversation, and that both in the talking about the report, much as you will see with this, by the way, one of the reasons that we are choosing to be very open, as always we have, but even more so about the initiatives that we are developing, is so that we get the conversation going. That's what's called building social movement. And with the task force, if you remember, the Black Nurses Task Force that we launched at RNAO, which is led completely, it was led by Black nurse colleagues from across the province and from all sectors and cohorts of age. We actually put it out all as we were going along in purpose. We had webinars, we had consultation, we had surveys, etc. And that unleashed a lot of movement, Susan, for the colleague that raised the question, a lot of movement about the lack of full representation at graduate schools, and perhaps even, Susan, at undergraduate, while the task force was initiated. So just to give you a little bit of a background, when the horrific murder of Mr. Floyd took place, I was desperate about what do we do about the horrific murder of Mr. Floyd. Not that things had not happened in Canada and that we had not talked about that, we had, but that was given social media it was unbearable. And we called the meeting, and in that meeting, what we heard, and Claudette and Angela will remember because I think they were there, what we heard is our own colleagues saying, this is what's happening to me in COVID now. This is what happened with my husband that is Black. I remember a white nurse that the husband was sent home, right? And she's an NP and she intervened, etc., etc. And it was devastating to hear our own colleagues. And that's how we launched right there. And then the task force, which then is a task force, as you know, only about the the systemic racism and discrimination of our own nurses right here in Ontario. Not that it's not happening in Canada and with patients, but we wanted to focus on our own colleagues right here in Ontario. And in that task force, both the survey and the review of the literature showed clearly, this is why it's called systemic racism, right? Because showed clearly, but we unleashed a lot of things now are happening in various universities, not only one. So I think it will slowly change the landscape. What we need though, Susan, is that it change much faster. I would like one of my colleagues, Dr. Claudette Holloway, I saw that you are here. If you can comment on that, please.
Thank you,
As a member of the task force, not only as president.
Yeah, thank you, Dr. Grinspun. I'd just like to say that in my experience and from my cultural background, getting the highest education was always important. But I found that years ago, and it still is a challenge, that financial support is not available. And due to the history of our people, you have to take this kind of expense on your back. I'm fortunate that I was able to do it. Not everybody is. But the task force and the report that we had from the survey shows that nursing continues to have systemic racism and that people cannot get ahead. And even though they have done all they can, they've got their highest qualifications, and yet they are overlooked. So I'm glad that RNAO has taken it on, and we will continue to fight it. We have over 19 recommendations that we need to continue to push forward. We need committed allies, not just people who will read the report and say, oh yes, we need to do something about that. We need to see some action. And I think that thanks to RNAO on the InFocus webpage, we can see all the information there. I'm fortunate to be the 4th Black president of RNAO. And this message has gone out from RNAO years ago. I've been a member for over 25 years. And at every annual general meeting, there was a call out from our CEO saying, what does your senior management look like? What does it represent in terms of who is on the front line? So it's a work in progress. People may feel guilty. I'm not here to make anyone feel guilty. I'm here to help everyone understand. And there are many others who can help others understand the mental pain, the loss of income to have advanced. So it is something that is ongoing. Certain things have highlighted it, such as the death of Mr. Floyd. We know that there were many others in our country that lost their lives. But as we said, we are trying to start in our own backyard. We are focusing on nursing. There's so much to do. So let's work together to bring it forward. Let's work together. We have a lot of up and coming young Black leaders. I'm on the outward path now because I've been in the profession for so long, but we have so many young and upcoming leaders. So sometimes the message is hard to take, but we're here to help you understand. But there are times when you have to understand how deep the hurt gets when things have been not progressing based on the way people look. Thank you.
Thank you, Dr. Holloway. And I do think that the issue, as you pointed, is both the education, is also what happens after the education, because it's safe to assume, and therefore then to address it and tackle it all the way, that if you have a group of 5 nurses white and 5 nurses Black and 5 nurses Indigenous, or 5 nurses trans, I would put that too, that likely the white nurses will get ahead, assuming all is equal, right? So we definitely need to continue to be purposeful about tackling it, addressing it. And I know at RNAO we are, but this needs to happen everywhere, including at RNAO and everywhere else. So thank you so much.
Thank you. I'd like to group 2 other questions about the motivation behind a PhD and what we know about nurses with PhDs. So one question is about, why would a nurse work towards obtaining a PhD, especially when salaries are sometimes the same or less than a bedside nurse? So what are some of the reasons? And then do we know, do we have any data on the different types of specialties, areas of focus? Do we have that breakdown yet?
So I will comment, and I will open it to anyone else that has a PhD to comment, because I think it's important to talk from where we are. I don't think there is a blank statement. So I always thought for many, many years that a nurse in any leadership position needs to have a PhD, call it elitist or call it whatever. When I came to RNAO, the PhD was not necessary. It was not in my job description in anywhere, but I thought I needed that backing from the expertise, the respect that it brings, the knowledge that it brings. I know that I went from a diploma nurse to an RN, and in those years there was no direct baccalaureate, and then to a baccalaureate. That was 7 years from the diploma to the baccalaureate, if you take all the years of education, then to a master. And I did it because I deeply believed it brought me additional knowledge, not because it was a requirement. At the time, none of them were a requirement. So that's from where I came. And much like Claudette said, not always I had the means even to cover for it. In fact, I was pregnant with a baby and my husband was studying. So sometimes we take it on because of whatever reasons. I just believe deeply that it will give me more knowledge, and it proved to be true. It brought me more knowledge. And has it helped? Knowing RNAO would not have been required at the time, but it of course helped. It helped at tables from a power-based perspective. When I will never forget that George Middleman one time said to me, "I'm calling you doctor only in front of the OMA. I'm not calling you doctor in every other meeting." Well, here you go, right? So it helped, but to me, it helped to me. To me, it helped at the heart and at the head for the additional knowledge that I was having. Others do it to open doors. Dion Sinclair, I don't know if she's here today. She's doing a PhD. I don't know if people know, but kudos to her. I know it will help her, both from a knowledge and from a call it power perspective. I don't know, but it is true. It is true that degrees in general help. The problem is, as Claudette said, not everybody has life circumstances, and by that I don't mean only means. I mean a family that is generous and says, yes, go and do a PhD. It takes a lot of effort and time. It's not only an issue of money, right? Or to go in debt if you need to go in debt. So, the same as we said, the feast of opportunities, there is a feast of reasons why people will secure a PhD. And then you need to know, I spoke with a colleague yesterday, and I said there is a period of time that between getting a degree and you getting your next stream in terms of what do you want to do with that PhD is important. Because if 3 years lapse between you getting a PhD or a master's for that matter, and you don't secure what was your dream or closer to your dream, and maybe your dream is to do the same. I came to this country as a CNS. I didn't want to do something else. In fact, I escaped from management. But there is a period of time, and this is, I don't think people often understand that is critical. It's critical, because if not, the question becomes, well, she got a master's, and if the answer is, and she's doing the same as before because that's what she or he wanted to do, or they, great. But if it's because you couldn't, get your dream, that's different. Same with the PhD. So that's as an advice to people that are getting or did get the master or the PhD. If you did it because you want to advance your knowledge in direct clinical practice, look at Spain. Many, many, many frontline nurses in Spain have a master's and a PhD, because that is what the Spaniard nurses deeply believe is necessary for direct practice. So it depends, colleagues, for what and for why you are getting it. But if it is because you want to open doors to another trajectory, then do it fast, because if not, after a few years, it actually may backfire. I don't know if that helps, but that's life experience. Maybe Claudette, you want to comment on that. This is for the nurses with PhD or masters to comment. Christine, you have a master, so comment.
Sure, I can tell a little bit about my story and what provoked me to attain a master's degree. I was actually inspired to work towards a master's degree back when I was a baccalaureate nursing student, and that was because I had a real life experience. I told you about this, Doris, of seeing nurses advocating at Queen's Park about nursing policies when Mind the Gap was released. And so for me, I had motivation in terms of career pathways in order to seek certain educational opportunities. So in my case, it was for a master's of nursing and related to policy, because it started with a career idea and being inspired in that way. And so that's my little personal tidbit.
Thank you, Christine. I love some of the comments in the chat. I will give the podium to Dr. Holloway, but look, a mentor told me that nurses need PhD, so others don't do the thinking for us. Well, don't assume a PhD is the only way of thinking, but yeah, there is a bit of that too. And then another colleague said, Shannon, I have a PhD in archetypical psychology, cultural mythology. We need to have her do a webinar for us. Wow. And I completed PhD for personal gratification, curiosity, training my brain and think different. This is why I thought that I was going to do a second PhD, but once I finished the first, I said, done. Absolutely, yes. Not for financial gain. So different people, different reasons, eh? Yeah. To you, Dr. Holloway, why did you do your PhD?
Well, as I said, I've always loved learning. So it was about getting the best education that I could in the profession that I was fortunate to be involved in. So it was, and the PhD is not the end. And I had a job for many years that did not require a PhD. Any of the jobs I've had did not require a PhD, but it had nothing to do with me because I wanted to do the best I could in terms of my education. So the other thing is, so once I finished the PhD, I was like, okay, so what else do I need to learn? So I went over and I studied for the Certified Health Executive. And, and it doesn't end there. I recently just finished doing the spiritual course at Dayton, Ohio. So I want to say that it's not so much to get a title. I didn't do it to get a title. I did it to get something that would help to broaden my horizons and to prepare me to accept what changes comes about in this profession, because it's always changing and you need more information. You need to be able to absorb the information, understand the research, and so that I can help others along the way. So anyone that needs to contact me, please do. I'm here to encourage you. And anyone that knows me well, I'll say, you're doing some study? Okay, that's good. So what do you want to do next? Well, I'm thinking of, I says, well, it's a part of the journey. You're on the journey. So even though you may not be studying at the level that you want to yet, it is a part of the journey. Because even for the PhD studies, I was like 3 years on the journey before I actually started the course. So it's all relevant. It is all a part of this great profession that we belong to. So I highly encourage you, wherever, as Doris said, wherever you want to be the best at that. Be the best at that, because all together we can transform this profession. And I'm glad that I was able to do this doctorate. It's not in nursing. I wish I could have done it in nursing. I tried, but there were no opportunities for me in Canada. So both my graduate degrees are from the US, and I want to bring that back to Canada. But the important thing is that here I am late in my career, and I had the opportunity to be the leader of this organization. So we can now say we have a Black president, that she's not just a token, as people say. I have done my homework, and I will continue to do my homework, along with the support that I get from our CEO and our staff. So I'm still on the journey, and I'm ready to learn even more. So join me and ask me if anything I can do to help you on your journey. Thank you.
Well, if she is not If she's not inspiring, I don't know who is inspiring here. Every time I hear you. Amazing. Let's not only do PhD. Susan, why did you do your master's? And when did you, and when?
Sure. When was that? I think it was around 2008. And I saw nurses being really effective in their work, in their roles. And I thought, you know, she's got something that I don't have yet. She's got a skill set that and an ability to make change happen, execute change that I didn't currently have. And I thought, okay, well, I've got to go back to school and learn some of these approaches in a structured way. And so I did my master's in public health and in global health. Yeah. So it's just, I recognized something that was, I didn't have the skill set to advance my career and make change happen the way I wanted to.
Amazing, amazing. Anyone else that wants to contribute? Why did you do your PhD? Or do we have other questions, Susan?
We do have a couple more questions.
Go for it.
But I'm wondering, since we're on this topic, if Lynn.
But we have May. We have May Cat. I heard Matt referring to May, so May must be here. So let May. May is our indigenous, or at least my indigenous guru, completely a guru. May, why did you do your master's? And May also got an honorary degree from UOIT. So here you go, May, tell us, and then we move on, Susan.
Good afternoon, everyone. Thank you, Doris. So, you know, Indigenous students were really not encouraged, I guess, to pursue higher education. In fact, in high school, I was told I wasn't smart enough to go to university. And in some ways, it can become a real downer. I think it can, take a lot of motivation. So I did the route that was out there, right? So I did the diploma at the college. I did a degree, a BSCN, and then I also did a master's and then the nurse practitioner. So the laddering approach was really important. And then somehow, with family and having to work to pay the bills, I think that ladder approach was really important. Most nurses that are Indigenous that I know are raising families, have a big role in the community. Their leadership roles are not necessarily in the nursing profession. I think their leadership roles are in their community. So I think because of that, it can motivate you stronger to achieve some level of academic excellence. So yeah, it was nice to get a PhD, be recognized. It was actually, I was nominated by the School of Nursing at Trent University. So I think, having your peers recognize, your career successes was really important. And I had a really good time partying at Trent, so worth it. Thank you.
Thank you, May. Well, it was and it continues to be well deserved. Next, Susan, if there are new questions.
Well, I'm just thinking, and Imogene sent me a note in the chat about this too. Just some of the chat questions and comments have to do with barriers and facilitators for career advancement. One person was talking about back in 1992, there just were so many more opportunities outside of Ontario in terms of full-time employment and benefits. And where are we at now? Are some of those barriers, are there more facilitators in Ontario now? Another person pointed out nurses who have diploma RNs could they be more seamlessly advancing in their careers, BSNs with lower course load, those kinds of things. So looking at some barriers and facilitators and addressing those.
So I can comment both from Ontario, but also outside of Ontario. First of all, I don't think that today, from a financial perspective, there are less opportunities in Ontario than before. I remember when we arrived at this country, the only thing that there was is, yeah, they brought some of the programs to the hospital for diploma nurses to move into baccalaureate or for RPNs to become RNs, but not financial support. There was no really RNAO programs like NEI or any of those tuition reimbursements. There was, NPs didn't even exist, remember. I mean, they existed, but they were not legislated, right? And so it's not that there are less financial supports than before, right? Many people back then, remember, nursing is a female profession. And back then and now, many times it falls in the backs of nurses as women and all the responsibilities that they have, and of a family that either is supportive or friends or colleagues, etc. What there is now is the additional challenges that have happened, I would say pre-COVID and by and large also with COVID, right? That people have awakened to more reflection about life and about what they want of life versus, I think, we, the older generations back then, were more permissive about some of these constraints. They existed all along. I mean, Claudette, I think, spoke about that too, and how she took it upon herself. And I think it's a good thing that we are more questioning and that the newer generations want more. I think it's a good thing, whether it is on the issue of you need nurses, we want to be treated good. We need we meaning society, right? Need nurses. We need to be compensated fairly and have workloads that enable us quality of life and quality of work, and yes, to study if we want to study. And all the issues of systemic racism and discrimination in all of its forms. I think it's a good thing that this is happening, right? So, you know, I don't dwell often in the past. The past is the past for whatever reason it happened, and that the previous life was better and the previous generation was better, you know. That's often not the case. The question is, when we come with the third piece that will talk about what are the barriers, what are the facilitators, and there are many facilitators that people are not aware. And what is it that we or you or I need to put into the pot of soup? So I like to do analogies with food, into the pot of soup. And what is it that the system needs to put? It will never be, even in the case of the US, when I say that our colleagues get fully funded. I have a colleague there, Florence, that I met when I was at the University of Michigan in Ann Arbor, also like May, receiving an award there, Career Life Award, that I met her. And she is fully funded, guys. She's fully funded for a PhD. She still experiences challenges. She still experiences challenges not only with systemic racism, where she lives there in Ann Arbor, but in her own family, where her daughter one day said to her, "How come you're going to leave us? You are a grandma now. You need to stay with us and take care of the grandkids." So we always will need to put in the soup some ingredients that will never, I think also for male, that it will never come at no cost or no responsibility. You know what I mean? I don't know how to call it. It might be financial, it might be family, it might be so many things. And I think all of us can tell you stories about that. But we will tackle, and we need to see what from RNAO we want to tackle collectively. Where is the bigger bang for the buck, right? So NPs, we know the system needs. So, and one colleague said in the chat, you know, NPs should be fully funded, including their salary for the year and a half that it will take. Well, maybe yes, and maybe we should push for that. right? So that's one, because the system needs. We need to look at what the system needs and where the appetite of our professionals is, and try to match the two, and then push for that and get ahead of the game, because there is no system without nursing. There is no health system without nursing, and nursing is a trajectory. I don't know if that helps, Susan, but
Thank you. And I want to just augment what you were just talking about, you know, finding the right fit. People during COVID really rethinking what is most meaningful for them, and read two notes from the chat box, one from Lynn and one from Carolyn, if I could. So Lynn said that she moved from PSW, where I think she worked for 14 years, to RPN to RN to Director of Nursing. And her most satisfying role was PSW. As the Director of Nursing appreciates efficient RNs on front line, we need to be careful not to tempt them away too soon to administration. However, if they do choose to pursue further education, long-term care will support 50% of tuition for full-time positions. And there's a chat box note there as well, just talking about some of the resources in the long-term care sector. So I thought that was an interesting note from Lynn, just finding something that was most satisfying for her. And then the other one from
can I comment on that? Because I so agree with Lynn, and not only in relationship to PSWs. I made it my point in every country, and this is my fourth country. The third, I work as a nurse, but my fourth country I live, to always begin my career in that country with two things. One was as a staff nurse or a direct clinician, because you cannot understand nursing if you don't love and are passionate and understand clinical practice. You just cannot. You just cannot. You cannot become a good administrator. You cannot become a good policymaker, in my view. And that's advice that I got early on in my career from a faculty. Second, I also did a degree in the new country, always, because it allows you to understand the educational pathways. And I made a point also to study in different, well, it happened because I decided in each country to do a different degree, the next degree or a new degree. But don't study. I advised someone else a couple of weeks ago about this. Don't study always in the same school. You study in the same school, you get the same perspective. So don't study in the same school because I already know the faculty likes me, etc., etc., etc. You are going to get the same perspective versus if you move from school to school, it opens, it pushes your horizons. I don't know if others feel that way. That's my experience. It really stretched me to the limit, and that was a good thing. Back to you, Susan, and others may want to comment differently, please.
Can I read Carolyn's statement that just adds to what you were saying about working at the bedside? Carolyn says, I think it's also important to promote the idea of bedside nursing as a job requiring immense intellect and as a cerebral endeavor, just like academic work. I observe many very new nurses that even in year one of school, they're excited to leave the bedside and not feel restricted at the bedside, in quotes. I was tempted by the same thing early in my career. I did a master's and now work as a CNS. I love it, but my goal is to go back to the bedside and work as a bedside nurse for the rest of my career. I wish I had viewed it differently when I was younger, as I probably wouldn't have done my master's. I would have committed all my time to the bedside work I now love. So I thought that was interesting too. So I'm kind of scrolling through the comments, but I'll see if any other colleagues have picked up any themes, or if there's anyone who wanted to actually unmute their line and speak. And then maybe after that, Doris will go into some of the questions.
Absolutely, Susan.
I just want to say, if I might, Madam Chair, that for the internationally educated nurse, which I am, I came from England to this country as a qualified midwife and a state registered nurse, and I had to start all over again. So even though the timelines may not have been as critical as they are now, we need to understand the challenges that they're going through. But I agree with you that not every degree has to lead to a higher position. And I've worked as not a frontline nurse, because I've done my share at the bedside, but I was also in public health. So while we tend to think of hospitals and the bedside, there is also public health where you still need those that advanced education to help you along. So please, let's understand the broad scope of nursing, those that are in informatics, etc. And again, I think each nurse needs to be an ambassador for the profession. So I understand where I am working, but I also need to broaden my horizon. So we also need to educate ourselves about our profession as a whole. And the thing that I'm studying now that I want to encourage everyone to do is to learn more about the indigenous ways. So I'm learning more about the 7 grandfather teachings. I had a wonderful time at the AGM on a panel with May Cat. So learning more about the design of the Wampum Belt government, what is behind that, what it meant when they sold the land for the next thing, how it impacted them. So there's so much learning to do about our profession, as well as how we take care of the clients and the patients that we serve. So it's just so dynamic. And I think I might run out of time. I'm gonna have to be around till I'm 100 to get it all in.
That's a good thing. That's a good thing. I want to comment to Mary Lou about the baccalaureate. Thank goodness you have a baccalaureate. I didn't have it at the beginning. I had the diploma, and that was fine. That's what was at the time, and then the baccalaureate. And please never, never, never feel that if you don't get a master's, you don't get a PhD. That's where we started the conversation today. It's what people want to do, right? That we need to respect. And yet, if people want to do something else in that career path, sometimes it's going back to a previous not degree, because you cannot go in the previous degree, but previous role, is what you want to do with the profession, and how RNAO can aid in making that wish a reality. That really is where we are with this. And yes, the great majority of colleagues in their entire careers, they are PSWs, they stay as PSWs or RPN or as RNs. And that is absolutely perfect if that's what they want. And we need to celebrate colleagues like that. And if they are doing it because they cannot do something else, because of life circumstances or workloads or whatever, that's where RNAO has a duty to intervene and to create the bridges so people can stay on the bridge where they are put, holding that pole in the bridge for the entire patient care, or move from pole to pole back and forth. That's where the association needs to be, for you and with you. I don't know if that helps understand from where we are coming, and so we build it together. So the bridges become bigger and bigger and bigger, and better for people to walk through that bridge and to stay put from, in that bridge if that's what they choose. Back to you, Susan.
Thank you. So we've got a half an hour left in our time together. We've got 4 questions on the screen. I think these are essentially what you were saying before, Doris, and you had a thought earlier that we might break up into, or go into breakout rooms to discuss these. I'm wondering what your thoughts are now that we've had a further discussion. Where should we take it from here in the last half hour that we have together? Also keeping in mind that the next webinar, it will be a part 2 of this topic.
Susan, I would very much like, before we depart, first of all, if there is a poll on how, 2 questions. I don't know how easy it is to create these polls, but I ask and then you tell me, no, we can't. Okay. And that's totally okay. One about, did they find the conversation interesting, engaging, etc.? And another one, and to rate it. And then I also would like for people to have a way to send you feedback on what they want in the next one, right? Where no doubt we will bring the pieces of what are challenges and opportunities, and hopefully the inventory of financial supports that exist that people may not be aware. So we will post that on the website also and have it be built with RPN for RPNs and for PSWs, also with JPNC members, etc. I will bring it to JPNC to build that type of inventory. But also what else people would like to hear, right? Because I see a lot of appetite and I want to make sure that we capture some of it, please.
Okay, that sounds great. So Olivia, if you can work on the poll question, looking at level of interesting or engaging. I guess 1 would be not at all interesting or engaging, and 5 would be most interesting and engaging. Olivia, is that a possibility that you could do that now?
Or we can ask meanwhile questions, meanwhile that we give Olivia time to build the polls.
Sure. The other option, yeah. And then I can also work on seeing if I could get a word cloud, Doris, so that people can put in.
Oh, I love it. I love it.
So I'll work on that, and maybe Irma Jean, you can help out with the chat box questions. Can we divvy up jobs?
Yes, for sure. One of the comments I did make in the chat myself was the discussion about working at the patient side and how we really need to reinforce healthy work environments for nurses, especially those working directly with patients. And when we take this tool further, that's an area that becomes a barrier we have to address in the profession. And Doris, you said this could be an opportunity. And to me, this is one of the biggest opportunities for healthy work environment discussions and action.
Meanwhile, that we put the poll in Majin, do you want to share about the mentorship and leadership courses that are free of charge?
I do. We are, and actually we will, we're wrapping up the first leadership and management program for nurses. This started September 14th. It was focused on nurses in hospitals, and that was complex continuing care rehab, as well as acute and community hospitals. That was one stream, and the other stream was long-term care. And I'm sure Janet can add in relation to that. We really opened the applications to those who were interested as emerging leaders or first-time leaders. And we're able this time in kind of our pilot phase to accept 30 in each of the 2 streams. We are wrapping it up on Wednesday of this week with the 4th day-long session. The program has been outstanding from the perspective actually of many of the participants, and if any are here, we'd love to hear from you. And it really offered opportunities for both theory around key leadership and management concepts, sector-specific application, and also then small group discussion to really apply the content to case studies. And that program is free of charge. It will be offered again in 2023. We're just really planning out when to offer it, but the second offering will this time include primary care, home and community care, as well as public health. So we want to touch all sectors of nursing, and we'll work through numbers and streams a bit more in the new year, but it's a wonderful opportunity for those who are in management roles and wanting to really learn about the role and how they can make the biggest impact and again
Imagine, if I
contribute to
may,
healthy work environments.
Imagine, let's let one of the participants, I just saw a comment between Janet and Sandra. And I don't know Sandra, but Sandra, maybe you can give us your first-hand experience with the course. And then the other thing I do want to remind people before we put the poll and before we depart about the application for nurse practitioners in long-term care. Please remember that you can hire nurse practitioners and you can claim the funding for the ministry. And so far, I know that those that have done so and have applied are receiving the funding. I know firsthand because I was notified by 2 in the weekend. So please continue to apply. There is 75 positions up to March 31st. So if you work in a nursing home, speak with the director of care or speak with the administrator. Make sure that if they have 1 NP, but they can have more because it's 1 per 120 residents, that you guys apply for a nurse practitioner, hire the nurse practitioner, and you will get most likely the funding reimbursed. So that's really, really important. And keep going because we haven't reached the target. Sandra, I don't know if Sandra is there and if Sandra wants to share, but I saw the comment, so here you go.
Yes,
I think
I am
Sandra's
here.
in another program.
Yeah.
Sorry,
I made a mistake. I'm in another program. I'm in one that Advantage is doing, and it's actually, it's amazing, but I would
Well,
love
that's
when
good.
the opportunity comes up to do this one.
Don't worry, Sandra, it's good. If Advantage is also good, giving the more, the better. And it's not a competition. If it's free of charge, the more, the better. So go for it. Okay, Susan, you want to do the poll or you want to, the questions, can you put them? We have them there. So
I'm going to, so I just put the link and I'll put it in one more time. Let's see if I can, the word cloud, there's a link to Menti and there people are already starting to fill it out. So why don't we do that as well?
where did you put it, in the chat?
Yeah, it's in the chat.
Yeah.
Can you put it again in the chat?
I'm gonna try to do that. This is
Can you put it again on the chat, please?
I'm trying, yeah.
Okay, I don't see it. That's okay. As long as others see it, that's all good, Susan.
Yeah, let's see. I can't seem to go back to that. Is there someone else who might be able to?
Olivia did. Olivia did.
Okay,
Olivia
thank
did.
you, Olivia. Yeah, so what I'm going to do is just share my screen so we can watch this word cloud come together. There we are. Okay. Sorry, I'm having a bit of difficulty getting this up, but what I can do is we can certainly share this with people afterwards as well. But I'm seeing, I'm going to read some out.
Do you want Raul to come and help? Or you are good?
Possibly. I need to fill in this space. Maybe we can do the poll while I sort this out. I need some support to just get this going on my end. And maybe we can run the poll, Olivia, while I try to get this up.
Sorry, Susan, did you want me to run the poll?
Yes, please.
Okay, so I'll be launching the poll right now. Thank you.
And Olivia, can you share the results, please?
Can you confirm whether you see the results?
Yeah, we can see them.
Great.
Susan,
Yes.
Raul is coming and he's going to help you with the cloud.
Okay, thank you. Yeah.
Some things I cannot help you at all, but he's
Yeah.
coming as we speak. Raul, let us know when you're in. Olivia, let us know when Raul is in.
Hi, Doris. He just came in, or he's
Oh,
joining.
fantastic.
Yeah.
Fantastic. So, Raulito, we need help with the cloud.
Just give me one second. I'll get it. I'll get into it right now.
Do you want to put the link again, or what's the?
Just let me know if you have the link of the presentation, and I will and I can do it right away.
I'm finding a different method here.
Can you send what you did and let Raul just take care of it? He will help us, Susan.
Yeah.
Thank you.
In the meantime, I'm wondering if Matt has anything that he would like to share in terms of what the team is doing to advance this work.
Thanks, Susan. To advance this work in particular, as has been noted a number of times, this is an ongoing project, and the next step is to incorporate feedback that we're receiving from various places, including your own here today, and develop that last and final graphic, which will show the issues and opportunities in the profession, and accompany that with explanatory notes and a narrative. So we're looking forward to doing that. In the meantime, one of the big initiatives we have underway is for everybody to participate in is our action alert, urging the provincial government not to appeal the court decision on Bill 124, and you can find that action alert. Actually, Christina, can you cut and paste that, or copy and paste that into the chat? So it's, thanks, Christina. So that's readily available, and it's an easy way for you guys to address one of the biggest constraints in the nursing profession these days. We've done the writing for you, so put your postal code in and away it goes to the Premier and gang. But I would also encourage folks to always be writing, whether you're writing on Twitter or other social media platforms, or writing a letter to the editor, writing your own op-ed. Write and tell your stories about what's happening in the profession, what a wonderful profession it is, what your hopes and dreams are for the profession, what issues need to be addressed in the profession, and get that out to the public. It's not just about the big national newspapers. Most people pick up their local newspaper before they pick up the Globe and Mail or the Toronto Star or anything. And if you have a second language, then write in that second language, or let me put it this way: if your first language is in English, write in your first language in a newspaper that your language community reads, because those are well-read media too. So yeah, write. Tell your stories, please, and fill out our action alert. Thank you.
That is so important, Matt, the issue of your first language and to use it, because that's an area that we keep trying to push, and with the help of all of our members and the marvelous fact that in Ontario, in Toronto, in many big cities, not just in Toronto, people speak multiple languages. Use them, use them, use them, because your communities will learn from you guys and from all of us in our own languages a lot more than from newspapers often. And speaking the places that you go, where is a church, a mosque, a synagogue, the store, the neighbors, right? Yeah, thank you, Matt. Okay, are we putting a poll before we depart?
We've done the poll, and
Oh, sorry, not the poll, the cloud.
okay, I think we've got to go old school on this, Doris. I did it on my other computer, and it just I had to restart my other computer and things. So this is old school. Can you see it? Okay.
Well, of course we can. That looks wonderful. I cannot read it, but I can see it. It looks pretty.
Yeah. So, yeah.
Susan, we all learned to do cloud from you, so here you go.
Well, yes, it's just technical difficulties on my home computer. But anyway, what we've got here is these are some ideas for part 2 of this webinar series that we'll have in February, the new year. So we've got retention, respect, agile workforce, equity in nursing, forecasting nursing trends, lots of great ideas here. So we're going to save this and use this to help inform the plan for part 2 of this webinar series. So I hope some of you can see some of the words there: practical suggestions, college representatives, nursing in the North, safety in nursing, scholarships, pathways, public health nursing, like different sectors there. Love what you do, success stories. So there's lots of great ideas here that can spur the development of our next topic in February. So let's see, it's 3:47.
I think is Raul putting the one about today? I would like to hear about today. Or did we do today? And I missed that.
Yes, we were doing the poll at the same time, and
oh, good, all good then.
And the most of the participants rated it 4 and 5 out of 5. So thank you for that. And even in this word cloud, I think there are some words there like inspiring, and maybe that had to do with today, or maybe that has to do with wanting more inspiration, because I think, as you noticed, you know, as you said very in the beginning, Doris, that this is a feast of opportunities. And I think we're hearing lots of great ideas of nurses advancing their careers up the ladder, and also those who are really finding it rewarding to stay exactly where they are because they're finding the work meaningful. So I'm seeing lots of comments here in the chat box about thanking for this webinar today. And Doris, did you want to give any closing remarks?
Absolutely. I'm inspired by the high degree of participation. We had well over 100 people. I think we reached like 120 at one point. That's wonderful that people made the time to come and share. The comments, the questions, the ideas. I want to thank our president, Dr. Claudette Holloway, because such inspiring comments. And to you, Christina, for the tremendous presentation that you gave. And more than only the presentation, Christina, the homework that went behind with you and Matt and the entire team. Amazing work to be continued. I also very much like the way that we are doing a broad consultation, both with members, with the assembly, with the board, with members of RPN, of the College of ONA, of our chief nurse, and it will increase to others in the go forward, including to people that participated today and others. We will be posting it Once we get feedback and we do next reiteration of this aspect, just in case we get corrections, especially from the college, you know that we are all on the same page with the facts that we have, and that then we can post it for others. Number one, so you see yourself in the picture. I think that's the best retention and recruitment, quite frankly, to see ourselves in the picture. And also so we can discern together the next areas to push for advocacy and for funding. I also think that it will be very, very important when we post the various initiatives as an inventory that are already in place. Again, it's easy to get drawn into what needs to be filled in the cup, and always there will be, but let's also look at what's full in the cup. No doubt that nursing is a feast of opportunities. I can tell you, if I needed to choose all over again, I would choose nursing all over again. And I think many of the people that participated today will say the same because they made the time to come. That doesn't mean that we cannot make it even better, even more fulfilling, even easier for those that want to stay in the same role that they are now doing, which is essential, which is the majority of nurses. And for those that want to build next journeys, whichever those journeys are, whether it's a specialty, whether it's go back to clinical practice, or whether it is to continue with the formal education in terms of specialties, which we need. We need more not more specialties, but we need more people in the specialties, no doubt. And by that, I don't mean only ICU and ER, by the way, I mean also rehab and psychiatry and family practice and community care and etc. Street nursing, and together, I think together we can make it happen. So those are just closing remarks. Thanks for organizing, Susan, and to all of you for participating. And next time will be, what's the date for next one, Susan?
Monday, February 13th, same time, 2 to 4 p.m. So we are keeping the chat box so that we can review the chat box in case there's anything that we may have missed. And we have that, and we have the word cloud to help us inform the next webinar. And yeah, so this is the last webinar of 2022. And certainly, I think on behalf of RNAO, I just want to thank you all for your participation and wish you all the very best, that each and every one of you have some moments of good feasts, great food, time with loved ones over the holidays, however you might celebrate. And best wishes for the new year. So we look forward to seeing you all in 2023.
Thank you, Susan. And for colleagues that are working the entire holiday, please know we are with you, and also know that I'm on call the entire holiday. So if you need an ear, if you need a shoulder, if you're desperate in one of those shifts that are short, please know you can always reach out via email or other means, and we will be here for you. Hopefully you don't need a lot, but if you do, we are here for you and with you. Thank you so much.
Thank you, everyone.
Bye all.
Bye.